David à s'asseoir quand il s'endive. C'est-il vous, c'est moi, mais non, c'est l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Ils sont comme cul et chemise, et quand on les verbalise, il accompagne au violon son accordéon. Il passe une nuit tranquille, où ils ont matin, il refile un peu d'air dans les poumons de l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Parfois il lui massacre ses petits boutons de nappe, il enfourche à son veston, ou l'accordéon lui emprunte ses bretelles pour secourir la ficelle qui retient ses pantalons en accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Mais un jour pas lassitude, il verra la solitude se pointer à l'horizon de l'accordéon. Il en tirera 50 centimes à la brocante et on fera plus attention à l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, l'accordéon. Accordé, accordé, accordé donc, l'aumône à l'accordé, accordéon.
All right, we're ready to end a lovely day together, but we first need to find the lovely beholder of this purse. So I could take it back to Colorado, or maybe I'll just set it up here.
We'll call it a pouch.
I'd love that. Awesome. So a black pouch has been found. So I cannot think of a better way to end a lovely day than being given the opportunity to introduce Dr. Chris Swanson. I'm Margot Karsten with Creative Healthcare Management. I'm blessed to be the CEO of an amazing company that Marie Manthe founded 30 years ago. And we've evolved to be just fortunate to walk into organizations and be invited to help deepen cultural practices around caring. And that can look as far as formal leadership work and frontline leadership work. And so our amazing journey has been just outstanding, and our leading work now is around creating wisdom from reflective practice. And so we really believe the chaos will settle down when we stay centered around the patients and communities we serve. So I find joy every day I wake up in my work, and I hope that you do too in the work you do. With that, we are pleased to have been sponsoring the Summit of Sages, and specifically thrilled to introduce Chris. It's with great honor that I introduce Dr. Swanson, a colleague with whom CHCM has had a long and wonderful relationship. We are so pleased to have you with us today and to end this lovely day together. Kristen is currently the Dean and Alumni Distinguished Professor of Nursing at the University of North Carolina, Chapel Hill, and also serves a joint appointment as Associate Chief Nursing Officer for the Academic Affairs at UNC Hospitals. She's earned her bachelor's degree in nursing from the University of Rhode Island, a master's degree in adult health and illness nursing from the University of Pennsylvania, and a PhD in psychosocial nursing from the University of Colorado. Her particular research interest is in miscarriage and early pregnancy loss. She began this work with her dissertation, The Unborn One, a profile of the human experience of miscarriage, and has continued studying this area both as an investigator and a consultant to other researchers' work. From this work emerged the Swanson Theory of Caring, a mid-range theory that outlines 5 caring behaviors that enable caregivers to help patients and families achieve their goals while enhancing professional pride and meaning for caregivers. If you ever want to see joy in someone's eyes, ask Chris what she just shared with me. She was recently named Virginia Mason Medical Center Distinguished Nurse Scholar in recognition for the work she is doing through integration of caring from a system perspective in lean concepts. So please welcome Chris to end our day.
Now am I on? Yes. Okay, so I was saying it's great to be in Minnesota. When I did this work on caring, it was always about my own research, wanting to make a difference for women and then ultimately couples that miscarried. And some of my earliest papers that I wrote was discovered by this lady named Mary Kolaroutis, who worked at Abbott Northwestern Hospital. And she called and asked me to come and talk about caring in practice. And I remember at the time thinking, well, why would you ask me to do that? This work on caring is all about pregnancy loss, and she convinced me it had something to do with a concept she was playing with called patient-centered care. And I think back now to how awesome that was. And I came to Abbott Northwestern on National Nurses Week, and it was the first National Nurses Week talk I ever did. There's been a few since. And she brought me back 3 times. And each time I would be in awe of what was happening at Abbott, which then became Alumni, which then became Minnesota. And I was just, so when I come back today, it's like coming home. It's wonderful to see what's happening here. Okay, let us begin. So the day that Joanne called and asked me to do this, I had just finished having one of those conversations with somebody that said, you know, I know that's the way it's been for a long time, but that's no longer acceptable. We're going to have to change the way practice happens in your unit. So I'd had a very tough discussion. They left the room. We weren't singing Kumbaya. My knees were going like this. And then the phone rings, and they said, Joanne Dish wants to talk to you. Me. I pick up the phone, and she said, I'd love for you to come and talk about finding joy in the workplace. And I remember taking the phone and going, are you talking to me? So, stranger things have happened. Here I am, the gift of caring, finding joy and meaning in the service of others. Okay. So I have to start with a little bit of a disclaimer. As a scientist, less than 34.72% of this talk is data-based or empirical. It was written truly with a lot of soulful thinking, risk-taking, making myself open up my heart and tell my left brain to be awfully quiet. I decided my criteria for truth in this talk would be aletheia, which is a very fancy way of saying darn good enough. If it works, it's what we're going to go with. And it's inspired by my stringing together the best of both things I have witnessed in working with people in practice, as well as things that have happened in my own life. So, for the scientist, here's my theme. She took the leap and built her wings on the way down. That's what's about to happen here. So I'm going to start by defining what joylessness and joyfulness means to me. Joylessness. Living as though you will never obtain all the joy to which you are entitled. I think that's one of the saddest statements I've ever read. Allowing negative energy to open a franchise in your life. Accepting fear as the warp and scarcity as the weft of your life. Sitting around waiting for life to get better. And pointing, grumbling, and whining in lieu of owning, seeking, and acting to make it better. And I think that applies to all of our work sites, doesn't it? It's so easy to go down this drain of ain't it awfuls instead of saying, yeah, it is. We've got to do something about that. And maybe I should be the one to get it started. So, this is my depressed stance. When you're depressed, it makes a lot of difference how you stand. The worst thing you can do is straighten up and hold your head high, because then you'll start to feel better. And if you're going to get any joy out of being depressed, you've got to stand like this. Charlie Brown. I like this. Worry does not empty tomorrow of its sorrow. It simply empties today of its strength. So joyfulness. Knowing you're exactly where you're meant to be. I think of Rachel Naomi Riemann, if I got the name quite right. I was on a stage with her one day, and she kept just looking at the room and going, what if it were to turn out you are exactly where you're meant to be at this moment in time? And there are times when I am in conferences that I think are boring as heck, and I say to myself, what if you are exactly where you're meant to be at this point in time? When I have to have a difficult conversation, or when I witness something that is not comfortable, I say to myself, what if you are? And I share this with my students always. When they fear what will come up when they enter the field, I said, you know, we're educating you right. Trust yourself. And when you're scared, say to yourself, what if I am exactly where I'm meant to be at this point in time? It can carry you a long way. Affirming life through service, creation, and connection. To me, that's what joy is all about. You know, it's like being at Thanksgiving dinner when you've run around like a chicken with your head cut off, cooking all day long. I had a man that I was dating at one point, and I had put Thanksgiving dinner on the table for not just my 2 kids, but him too, and he hadn't lifted a finger. And I had worked all day long, and finally we get to the table. Of course, the kids have to go to the bathroom just before you're going to sit. We all get to the table, the food's on the table, and this man says to my 2 sons, stop, don't eat. My kids and I are all looking at him, and he goes, look around, what do you see? And my boy said, turkey, carrots, squash. And he says, nope, nope, nope. And I'm thinking, come on, the dinner's getting cold. And he's saying, what do you see? What do you see? And finally he looked at my boys and he said, what you see is a woman's touch. Look what your mom created for us. And you know, I think to myself how he affirmed my service, my creation, and the connection between all of us. I dated him for at least another 3 months after that. It's being intimately connected to people, purpose, and place. And we've heard that so much today. Joy comes from knowing you're with the right people. And remember, they may not be the people you would have chosen, but they're exactly the right people for you to be with at this moment in time. and to find your purpose for being with these folks, and why did God bring me to this place at this time? It's a great, awesome question to ask if you're wondering. It's experiencing the awesomeness of living your own life, the one that's meant to be yours. When you think about it, you got one. And if every time you just stop and say, heck, this is why I came here, it's liberating to think that you are doing your purpose by being in this moment at this time. And nothing else, it's realizing grace, living with the faith, the hope, and the love that you were hardwired for from the minute you came into this world. We came with the body, we came with the mind, and we came with the gift of grace. That grace that allows us to be connected to something larger than ourselves. And knowing and letting that grace come to the fore, and not to be blocked by the voices of the world, not to be blocked by the voices of the grumblers, but to truly let that which you came to this world with bubble up and allow you to joyfully connect with somebody else. These are my definitions of joyfulness. And I like this. Seize the moment. Remember all those women on the Titanic who waved off dessert. We won't always know whose lives we touched and made better for our having cared, because actions sometimes have unforeseen ramifications. What's important is that you do care and that you act. That's so much like the poem we just listened to. What does matter is that you act. And you care enough to do it right. So my mentor as a doctoral student was Jean Watson. And Jean used to say to us, you begin with your very notion of what it means to have personhood. And think about it. What does it mean to have personhood? It means you're capable of finding joy, you're capable of connecting to a greater whole, you're loved, you're loving, you can be loved by somebody. It means you can be ornery, you can be a pain in the butt, it means you can be terribly difficult, but we all have a source of personhood. And Jean would say, and then if you can accord every individual you meet with the status of personhood, you look into them and see another person. Under that condition, your very capacity for caring will become very easy to access. Because when you look and see another human being, your humanness comes to the fore also. Mark Twain, the best way to cheer yourself up is to try to cheer somebody else up. I define caring as a nurturing way of relating to a valued other toward whom you feel a personal sense of commitment and responsibility. So whenever I present this, I ask people in the room to think of the valued other as two things. One, someone you love, and then the other, something you love doing. So, and I'm going to ask at this point in time if you would think of the people you work with, the people in your work unit, if you think about them as that valued other. And since the focus of my talk is supposed to be about finding joy in the work site, maybe I will ask you this time to really think hard about you, your work, and your colleagues as that valued other toward whom you feel a personal sense of commitment and responsibility. Personal. You can't sit behind a professional mask. You've got to show up and take that risk, show up as a human being. You have to have that sense of commitment to what it is that you do. You know that it matters. You choose to be there. And then, if nothing else, that sense of responsibility. Sometimes when I think about caring, I ask two questions. Is it a call to love or is it a call to duty? And I think when your profession hangs on caring, sometimes it's both. To act from a position of caring is to act from a position of duty. I'm a nurse. I'm licensed to handle that. I'm accountable for your care. That's a call to duty. I'm in front of you. We're together in this, and I care about you. That's a call to passion. And in our work that's related, it's both. And if you are a systems person, and you start to think about how do we make our organization work the best way we possibly can for every patient that walks in our door, and if you begin to look at every patient who walks in that door as somebody you've got to get the system right on, the organization right on, our unit on, you begin to do that acting and owning to say, what does it take to turn my unit around, my hospital around, my community, our healthcare system, to make sure that it is about that patient who walks in the door. That's caring. I say caring consists of 5 ways of relating to another human being or to that valued other: knowing, being with, doing for, enabling, and maintaining belief. And I'll talk about each one of these concepts separately. Knowing. It means that you simply try to understand a situation, an event, about what it might be like in the life of the other person. So when the student walks into the classroom or about to give their first injection, we may have taught 10,000 students how to give their first injection, but it's this student's first time. On your new hire to the new unit, that new nurse, okay, if you've been in the job for 15, 20, 30 years, you finally do get down a pattern of how to orient each new one. But it's taken the time to find out what it's like for this new student, this new nurse. It means that we avoid assumptions of what it's like. It doesn't mean you deny what you know. If you're a cardiac critical care nurse and you've done this job long enough, you know enough about it to start to ask the right questions of somebody who's come before you right after this news of, it may or it may not be an MI. You use your wisdom, your knowledge, your book learning, and your relationship that you immediately encounter, because this person's come to you vulnerable. Whether they are forced and you are forced in that moment, you are in relationship. So you take all of what you know to ask the question that must be asked to help this person feel safe. You assess thoroughly. You look to see what they say and what they don't say. You seek cues. If you're responsible for the unit, you stand back and you say, instead of why do they do this, you think, what is this a symptom of something larger? I remember my fundamentals of nursing instructor saying to me, this was a big lady, she was a Mass General grad, she wore a cap across campus, and she looked at me and she said as a student, you know, you walk in a room and a patient starts yelling, think to yourself, and you've never met them before, think to yourself, Kristen, maybe it's not all about you. Maybe there's something else going on in their life. When I went to negotiate to work with an Indian tribe in Northwest Washington State to do some community work, they had had many, many, many pregnancy losses. And I went to see the chairman to get permission to work with him, with the community. I walked in the door and he yelled at me for 20 minutes. He just kept yelling about this white girl that thinks she's going to come across the state and suddenly turn our life around. And I kept seeing that big instructor saying, Kristen, you walk in a patient's room and it starts yelling, maybe it has nothing to do with you. So I sat there and I listened while he yelled, and when he finally got done, he said, what do you want? And I said, well, the women in town have asked me to come and address what they were all calling the miscarriage problem. And he said, well, what do you think you can do about it? I said, I don't know. Listen, I've learned over time that when you lose a baby, it really hurts. And it doesn't just hurt the mother, it hurts the father, it hurts the grandparents, it hurts the cousins, and it hurts everybody else because you don't know what to say. I said, okay, you can stay. You center on the other. You let it be about them for the time that you're there. And you allow yourself, your personhood, to show up as you enter this relationship. If you really do look across and see what it's like for the other person, suddenly it's like that sponge that opens up. Your personality, your personhood comes and grows for having been in the presence of another and understanding what it might be like for them. Being with. Simple, it just means you're emotionally present to the other. You're there. You convey your availability. In my days when I practiced, that meant you put the call bell in sight. Now it means you tell them how to get you by Twitter, by tweet, by cell phone, by you name it. When you're at a distance, how to get hold of our unit. When I make sure that we discharge you so you won't be coming back, you tell them, now here's the way to get hold of me. You are with them, you are enduring with them, you are saying, even when you're not in my presence, you're on my mind. Kathy Barnard used to tell us that a good mother was one that had their baby on their mind all the time. A good healthcare provider is one that has their patient on their mind at all points in time. And for the patient who leaves the system after being discharged quickly with this huge wound that my wife is going to care for, it's knowing that when they leave our system, they're still on our mind, and we call back and say, how you doing? We send out somebody to help them to get through the first 2 days if that's what it's going to take. If our healthcare system is all about the patient, we're going to be making systems changes that gives that being with even after you've been discharged into the community. Now, you could begin to talk to me about the CMS reimbursement, and there's good incentive to do that. My colleagues at Virginia Mason have demonstrated to me that when it's all about the patient, you make everything about the patient. You eliminate anything that's wasteful that's not about the patient. You'd be amazed how much money you can save and you can still get health care right. It's about enduring with the other. We stay with them for as long as it takes to get through the hard time. I met somebody one time who had a false eye, a prosthesis. And he said to me, when he went to see his eye doctors, he said, do you know that they have known me since I was 7 years old and I had the accident and I'm now 40 years old? And he said, and every time I go to the eye doctors, it's like going back and showing them that what they did for me, I've had a full life. Think about that, a 40-year healthcare relationship. Isn't that awesome? Sharing feelings. You know, when we're present at the birth and we're able to yelp with joy, oh my God, it's a boy. Well, you know, when you lose your awesomeness in your work, it was a 50-50, it was going to be a boy. No big deal. But when you can remain fully present to the miracle of birth and yell, it's a girl, it's a boy, that's when we have still stayed fully vibrant to our work in the good times and in the not so good times. And I had this one woman I interviewed who had had 3 miscarriages, goes back to my dissertation work. And I said to her, what's that like to have 3 miscarriages? And she said, you know, by the 3rd one, all I wanted was my mommy. Here I am, 39 years old. I wanted my mommy to come and hold me and make it right. So I said, did your mommy come? And she said, well, that's another story. I picked her up at the airport. She got off the plane. The first thing out of her mouth is, oh my God, your brother's going through a divorce. You've had 3 miscarriages. I'm never going to get to be a mother. She said, the next thing you know, I had my mother home. She was in the Barca Lounger. I'm bringing her a cup of tea, and I'm thinking, who is the mother in this picture? She, for me, became the poster child for what it means to not burden the other with your experience of their experience. That fine line that we must dance between being emotionally present, crying with our patients, being frustrated with our patients, but in the end, remember who is the nurse, who is the physician, who is the vet, who is the provider in this picture. So it's about caring, being immediately present, emotionally sharing the moment, but being responsible enough and committed enough to know who's the patient, who's the provider. Doing for. Simply doing for the other what they would do for themselves if it were at all possible. As an administrator, it can mean pushing the budget out to the hands of the people who can make the most amount of change. It's about making sure that the right supplies, equipment, et cetera, are in place. It's about putting in those systems improvements so that you can show up and do for your patients what they would do for themselves if it were at all possible. As a mother, it's about setting up the tray with a shower curtain on the floor and all the peas on the tray so the child can learn to feed themselves. Because to failure to allow for that amount of autonomy means that I go to college with my son and continue to put the peas in his mouth. So it's doing for the other enough that they can succeed, but not doing it in such a way that they become dependent on you. We know that when people get entered into long-term care who are fairly well still functioning, they have the greatest amount of decline in that first year after admission to long-term care, because we, in a well-meaning way, take over and do for them what they're perfectly capable of doing for themselves. So it means that we perform competently and skillfully. Caring is not about separating out the skill and the competence from the compassion, not at all. It's about using your skills and your competence and your compassion to make the best for another human being who's entrusting their life to you. It's about comforting the other. One of the most beautiful things about being in healthcare is we are licensed to touch another human being in some of the most intimate ways. There are very few people who have access to that capacity to touch another person to bring them comfort. With our hands, with our mind, that we can anticipate somebody's needs. And you know, when you're getting to truly practice intuitively from what you know best, when we're freed up enough to do that, we do have the time to look ahead and see what it would take to make somebody feel safe. Now, how many of you are doing hourly rounds in your practice? And I know there's levels of resistance to that whenever people try to put it in place, but when you think about it from the recipient's perspective, if they know that once an hour somebody's going to be there to attend to whatever it is you might need, cold water, a chance to go to the bathroom, somebody to check in on me to make sure that I'm okay, whatever it is, if you take the patient's perspective, suddenly hourly rounds makes a heck of a lot of sense. It's about protecting the other. And if nothing else, doing for and doing it right is about preserving the dignity of the other human being. When you start to think about orienting new people to your units, or bringing new people onto your way of doing work, or when I think about bringing in a new faculty member into the university, it's about setting it up in such the way that they can succeed, using your expertise to anticipate for the other before they fall what are some of the pitfalls that are common when you come new into an organization or a system. Enabling. Now, those of you who are Melody Beatty fans will know that this was not the best choice of words for me, but she wrote her books on codependency about 2 years later after I had started to come up with these terms. But enabling means you facilitate the other's passage through events and transitions by supplying them with the information they need and the explanations they need to understand just what the heck is going on here. You validate and you give them feedback on how they're doing. Support them, allow them to be where they are, focus them in on what they're doing right, help them to see what they could do a little better. Work with people and generate alternatives. Okay, let's see how we did it this time. I had a friend who was a theater major, and she told me always at the end of a show, they come back together for just a few minutes to generate alternatives, how they could have done the delivery better that night. When you think about when we come together in a surgical suite at the end of surgery, is there a more logical place that you should have in end of show notes to say, how could we have done it better? When you think about any work day we do or any major initiative we pull off, when we come back together again and focus in on what went right, how could we do it better the next day? I run retreats at Virginia Mason. We get together 1 or 2 day retreats for nurses to remind us why we came into what we did. And these people are so into this lean systems improvement that at the end of the workshop, we always sit down and we say what was wasteful in today's retreat that we don't need to do in tomorrow's retreat. And I think it's fascinating when you think about whatever you do, think about what served the purpose, if the purpose was about the patient or was about the learner or it's about the new orientee. What did we do that was unnecessary or what did we do that we could have done better? And enabling means we think it through. Think it out loud with somebody through what they're doing. I think so much about these caring moments can be huge or they can be so small. Flu season shots right now, and the kids are lining up to get their flu shots. You know, you could just take the arm and jab, take the arm and jab, take the arm and jab, or you can say to the little child, all right, I'll tell you what, there's going to be a small cold wipe with this. There'll be a real quick little jab. You'll feel a sting for 3 seconds, and then we're going to put a Band-Aid over it. And I can do this whole thing in 6 seconds. You want to see me? And you say to the kid, okay, count. And so the kid's counting to 6 while you're doing the work, and he manages to get to 7. He tells you you did it wrong. You think, oh, okay, I'm going to learn it for the next kid, and you start all over again. But what you've done is you've informed, explained, you've helped them to focus, and you've managed to help them cooperate in their own care to get you through it. Caring can be so simple as noticing the person while you're doing the work. I remember my son had a soccer injury, and we're in the ER, and we're waiting for somebody to come and take care of him, and that poor little boy, his leg is hurting, and he's 15 years old, and he's rubbing his leg, and he's saying, Mom, come on, I gotta get in here. And the minute they come in, he's got the strong boy look on. And the first person comes in and says to me, what's wrong with your son? I said, well, he had a soccer injury. Well, I'll tell you what, we're gonna need to get him down to x-ray. We'll see him in a minute. My son's sitting over there. The next person comes in and she walks up to my son and she says, whoa, what happened to the other guy? Because if he got hit as hard as you did, man, that's gotta hurt. And my son said, yeah, it really hurts. And she said, I'll tell you what, do you think you can hang in there for like 5 more minutes? Because if you can, it'll allow us to get the x-ray we really need. Can you do that? He said, sure he could. It was the difference between acknowledging him and his suffering, immediately tuning into this kid's trying to hold it together and not cry. She met him with a little humor. She pointed out his toughness. She said what they were going to do. And it took just as long as the first interaction. Maintaining belief. Okay, Linda, you'll recognize that. That's UNC when we got this national championship in basketball. I recently had the chance to present this talk to the chancellor's cabinet on our university campus. And so I threw in the basketball maintaining belief thing. Sustaining faith in the other's capacity to get through an event or transition and face a future with meaning. Now, I'm going to say to you that I think maintaining belief is the core caring category. If we believe in people and their right to come through an event or transition and make meaning, we will take the time to know, be with, do for, enable the other person. And if we don't believe there's any meaning to be made in getting a flu shot or coming to the emergency room or giving birth, we're not going to bother to attend to the person at the other side of it. It's when you believe that healthcare is a possible moment for making meaning, finding purpose, and restoring your wholeness under those conditions, you believe in that person and figure out what's it going to take to let them know that you hold them in deepest esteem. You believe in them. You work with a hope-filled as opposed to a hopeless attitude. You hang in there no matter how tough it gets. Offer realistic optimism and help the other find meaning. And if you think about that as a work environment that we could all be in, what if we believed in ourselves and held ourselves in esteem? We offered a hope-filled as opposed to a hopeless attitude when the next change comes down the pike. We know we're going to be able to get through this. We've gotten through so much together before. We stay optimistic. It's not going to be easy, but we're going to get through it. And if you, as the leader, bring your team along, and by the way, as the leader, you don't have to be the one who's got the higher salary on the org chart. The leader is the person who takes this on, is the one who says, we're strong, we can get through this. Okay, let's get it together, we're going to do it again. I often think about the med-surg nurses in any school I've ever worked in. They never seem to fuss too much when a change comes down the pike, and it seems to be they're like, okay, here's the change, all right. You take this, you take that, you take this. Okay, it's another day, let's get started. Psych nurses try to figure it out. The maternity nurses whine, but the med-surg nurses get in and do. They have a constant capacity to make it happen. So putting it all together, caring is a nurturing way of relating to a valued other toward whom you feel a personal sense of commitment and responsibility. And I believe that the outcome of caring is a sense of healing. I have it on the part of the recipient, but I suspect it's on the part of the caregiver and the care receiver. When we take the time to understand what it might be like for the other person, the outcome is simple. They feel understood. When we take the time to be emotionally present, we let somebody know they're valued. When we do for them what they would do for themselves if it were at all possible, we create a space where they can know they're going to be safe and they're going to be comforted. When we enable them by telling them what's going on, inviting them to understand, to participate in their own care, we validate, we give them the information we need, we leave them with a sense of feeling capable, whether it's to get through the flu shot or to return to work and be able to manage the colostomy. And when we maintain belief in folks and their capacity to come through events or transitions and face a future that's meaningful and worth living, we create a sense of hopefulness. We know that even at death, hope is possible. We have witnessed deaths of despair. When people can't look at you, they feel no connection and they slip over to the other side. We have witnessed deaths where everybody's together. I think today about the comment, the speaker who said she was the last face with her mother in her, what was the word she said her mother said right then? It's all right here. Talk about hope even as you're crossing over to the other side. In fact, I would say to you, I remember when I used to work with physicians, when they would say there was no more surgery, no more cutting, no more medication, no more genetic alteration, nothing you can laser. And then they knew it was time to hand it over to some power beyond themselves to heal. I think for nurses, it's when we get to that place that knowing, being with, doing for, enabling, and maintaining belief is not enough to reach. That's the moment when we have to hand it over to a greater power, because sometimes the suffering is more than even the most caring in the world can honor. When I counsel many women who miscarry, I have come to realize you can't be in the work we do without having deeper questions about why are we in this world. And I know that when I work with so many women and I counsel them, and sometimes I don't see the softening that would suggest my words were healing. Sometimes they leave as upset as they were when they came in. And those are the moments that I heal myself by saying, it's up to a power far greater than I, and I have no idea why they came into my life at this moment. I gave it my best, and I know I did, and I leave it for someone next down the line to make a difference. So putting it all together, as a consequence of knowing, being with, doing for, enabling, and maintaining belief in another human being, we leave them with a sense of feeling understood, valued, safe and comforted, capable, and hopeful for the future. Now I'm asking you to think about your work site. If you truly took the time to know, be with, do for, enable, and maintain belief in each other, can you imagine a work site and how wonderful it would feel if you truly all felt understood, valued, safe and comforted, capable, and hopeful for the future in the group that you get to be a part of. So I'm struck by Haldor's daughter talk about 5 ways of being in relationship. This is a woman from Iceland. And she points out that we are always in relationship. The question is what kind? The lowest level of relationship she talks about, and we have to acknowledge they exist in our world, what she refers to as a biocidic relationship. These are relationships, and I think I'm going to invite you to think about healthcare environments as we say this. If we think of an environment where many relationships take place, if you think about your exact work unit, have you ever been in one where the energy was life-destroying, acid-edged, alienating, where we diminish one another for our anger and our hurt? Now,